And now we are on our third session on HYAFILIA, latest generation dermal filler. And I welcome here today Dr. Altair Menosso from Brazil, welcome, and Professor Aydın Saray from Turkey. It's a pleasure to have you here. Thank you for coming along. We're talking about the latest innovation in dermal fillers and latest technology in biotech through CHAR technology by Moderator, who are our brand owners. It offers a high level of tissue integration, control when we're injecting, handling and predictable outcomes. So we've got the benefits of a biphasic filler, but we've also got the other performance of a monophasic filler, the smoothness of the result, which is so exciting. So the structure and the predictability of our new HYAFILIA range is phenomenal, and it's leading in dermal fillers. So I want to now move on. First of all, I'm going to start off by asking the question to Professor Aydın. You've been now using HYAFILIA for some time. Tell us about the superior quality of HYAFILIA dermal fillers compared to those of traditional brands that we know.
I've been using HYAFILIA in the recent 5 years, and I'm very content with the results. As a plastic surgeon, I'm working as a plastic surgeon in Istanbul, Turkey. I would like to emphasize that, first of all, as a doctor, injection is a big problem in several HA fillers. So you can smoothly inject HYAFILIA product through the injectors. It is very important. And also, G prime values are very important when you use. And we have different choices like S, M, and V when you are using HYAFILIA. And recently, HYAFILIA fillers containing lidocaine has been added to the series. So you have many choices. I have seen low rate of complications in the 5 years term, and also adverse events in the early stages in the first 15 days and then later than 15 days are very low. So I use HYAFILIA with trust and with good results. Also, the patient's satisfaction is seen who underwent HYAFILIA injections, because they usually come after 1 year. As a doctor, usually when you compare with other HA fillers, these HA fillers' longevity is less than 1 year.
Yeah.
So HYAFILIA's longevity is usually more than 1 year. It's a very good in terms of HA longevity, HA fillers' longevity. So the patients are very happy, and also I recently finished a retrospective article about 106 cases of HYAFILIA fillers. And all the when I made a survey, almost 90% of the patients say they are very content with the results and they are very satisfied. And also, when I made another survey, if they are likely to recommend HYAFILIA HA filler to their friends or colleagues or other people. Yeah. So 86 of them are, they say, agree that they will send other people or recommend HYAFILIA filler to other people to undergo injections. So far, so good about HYAFILIA from my point of view. And as a surgeon, I find I would like to also make final implies about the HYAFILIA's place in surgery before and after. I think that as a surgeon, we can inject fat, for example, let's say, in the place of HYAFILIA or other HA fillers or other like calcium hydroxyapatite fillers. But you cannot predict the viability of fat, because normally we tell our patients that 50% of the fat can go away, can dissolve. But this is not real in clinical practice. Sometimes whole the fat is gone, whole the fat is dissolved. So the patient says, you have failed, you have done a fat injection and I see no result. Usually, fat, instead of fat, if you use fillers, as a surgeon I say it, it's what you get is what you see.
Yes, it's predictable.
Result, predictable.
And
that is not predictable.
No. I mean, I suppose if sometimes the fat may dissolve and sometimes it may not dissolve enough.
Yeah.
So you're holding on to a bit more than the ideal outcome is. With the HYAFILIA, you can sculpt to precision,
Yeah.
which is what is so
course.
good with our dermal fillers. And what you're seeing as soon as the patient leaves
Sure.
is what they're achieving once their downtime and they've settled in a few weeks.
You sometimes combine fat injections with facelift operations and other lifting operations. But in the first 2 months, the patient's face is swollen. But after 2 months, you can have a 50% good result, 50% no result. Maybe it's unpredictable or the patient is disappointed.
Yeah.
So these trustworthy filler injections such as HYAFILIA will reward your patients and will reward you, because HA fillers can be said that almost 100% trustworthy. It is normally found in your tissues. However, when you combine it with your facelift surgeries, 6 months before or 6 months after, you can, with trust, inject HYAFILIA to your surgery patients. Because in surgery, as I mentioned before, you do stretching of the face skin, you exercise the excess skin, and you lack volume in your surgery.
Yeah.
When you try to close and add volume with fat injections, it is unpredictable. So you can combine filler injections, HA filler with trust, because 80 or 90% of the market is filled with HA fillers.
Yes.
And this is always the second top applied aesthetic procedure, minimally invasive aesthetic procedure in all surveys of aesthetic surgery, American Society of Aesthetic Surgery, International Society of Aesthetic Plastic Surgery. In all these surveys, filler injections has second place. First is neurotoxin. This is quite normal, easier. So we can combine and give volume with HA fillers. And also we can get very good results with HYAFILIA because it has a longer longevity when you compare with even American-based products, even some of the European-based products. And also recently we have read more articles about the complications of American HA fillers. So they have problems also recently.
So that's really interesting. And I'd like to go back to your point about fat injections, like implanting fat to restore volume. And we can see that the dermal filler rate, and especially with HYAFILIA, complications are very, very low. Would you say much lower compared to fat injections? And if we wanted to resolve it, it's easy to resolve as well.
Hyaluronidase, we have a very powerful weapon.
Yeah, and it's a smooth integration as well. So, okay, so the other thing, you know, we spent time yesterday and we had a lengthy discussion about HYAFILIA. You said that the BDDE content is very low, which is preferred when we use it with dermal fillers.
Of course, BDD content is very low. This is a big advantage about HYAFILIA when you compare it with other HA-containing fillers. This is because of the new technology that Meditech developed to lower the BDDA content.
Yes.
This is all about dispersion phase when you are producing your hyaluronic acid, because BDDA is like a glue that connects the hyaluronic acid chains.
Yes, cross-linking.
Cross-linking, we call it. So if you use low BDDA to cross-link your hyaluronic acid chains, you will get better results, you will get better outcome, and also low likelihood of toxicity or complications where you are developing your hyaluronic acid. This is a very big advantage. And also when you compare with other hyaluronic acid producing technologies, just like VSO and other techniques, the cross-linking techniques, this is a big advantage. It does not cause any toxicity, it lowers the toxicity, and while thereby is also increasing the longevity of the product.
Perfect.
It's a big advantage when you compare with other HA-containing fillers.
That's really good feedback. Thank you very much. I wanted to ask you, in terms of the overall facial rejuvenation restructure when it comes to surgical procedures, at what point do we use fillers? Do we use them before? Do we use them after? And what is your recommended time frame in between using HYAFILIA?
HYAFILIA HA filler has a very good place I think it has an ideal place when you plan your surgeries alongside with minimal invasive techniques. In very thin-skinned patients, you can just, with a facelift, you can just stretch the skin, you cannot give volume efficiently. So what we do is, we, for example, give volume to the patient's face. Then after approximately 3 to 6 months, we operate the patients. That's why, for example, the most of the facelift and other surgeries regarding face is done between 50 to 65 years. And interestingly, when I go through these surveys, I see that between 30 and 50 years, in the 20 years gap, in younger patients, let's say, number of surgical procedures increased to 37%. So now younger patients are undergoing surgery, in brief. So we have to add volume in some of the patients. It is not very ideal in smokers and in heavy faces whom people are fat. But in ideal faces, facelift with some hyaluronic acid treatments, we will get good results. But it should be done in skinny patients. We can give volume, then we can do the surgery after, for example, 3 months or 6 months. So let me tell you that in thick-skinned patients, we have to wait after surgery to get good results.
Yeah.
So hyaluronic acid fillers and some other intermediate, let's say, minimally invasive procedures such as thread lift and skin resurfacing, also peeling and laser treatments, have a place when you are preparing the patient for a final facelift. But it's a good solution between surgery and not doing any surgery.
Yes.
So you can prepare. For example, some of the patients would like to undergo facial surgery at 18 years age. I'm against operating young patients, very young patients, and these patients usually are very restless about being surgery. They want to undergo surgery very quickly because of their age. You know, in those ages, beauty and their self-image is very important.
Yes, I mean, there's a lot of pressure at the moment on young people to look a certain way. So this is where they could get some sort of lifting and sculpting.
Sure.
But also, after facial surgery procedures, if there are any volume deficits, that's when you would go in and finish.
Yeah,
So
as
that
a
would be the
surgeon.
finishing with the HYAFILIA range.
Of course, I don't recommend them to undergo fat injection again.
Yeah.
Because it's a procedure which can be done under local anesthesia, but I'm not fond of it. It should be done under regional or general anesthesia in operational facilities in a hospital. So it's somehow, though it's easy, it's like a surgery. It has its own high cost, a little higher risk when you are operating the patient for harvesting fat. So this fat can be unreliable. Also, operating under general anesthesia it can be regarded as
Additional.
disadvantage, additional cost.
Yeah.
So I opt for injecting hyaluronic acid at first instance in those people. Also, let me tell you a dramatic statistical knowledge about this. Number of surgical procedures in the recent 5 years increased 111%.
Wow.
When you compare with minimally invasive procedures, mainly 80% of its HA injections, in the recent 5 years, it increased 4,468%.
Wow.
So this means, unfortunately for surgeons, patients are every day escaping from surgery. They want to refrain surgery, or they want to refrain as much as possible
Yes.
from, let's say, conclusive surgery, just like facelifts, neck lifts, brow lifts, and other lifting procedures that involve surgery. So the patients are hesitant. And instead of doing nothing, we can give more volume to their faces. We can, in the meanwhile, they can be affected from their friends positively, and they can undergo fillers injection. Maybe in the following years, they can be persuaded to undergo facial surgery, just like facelifts and other surgeries. Also, facelift surgery has also pros and cons, such as nerve damage, wound healing problems,
Yes.
and also long-term swelling in their faces. So this can be a disadvantage.
Yeah.
So the new trend is something magical without surgery the patients are
Yeah.
opting for or dreaming for.
And this is where I think we come back to HYAFILIA for safe, predictable outcomes.
Sure.
But the thing that I want to really mention is the injection force is soft. So we have more time. Because the injection force is soft, you can slow down and watch exactly what you're doing and sculpt the face. Which brings me on to the question to Dr. Altair. You are a professional with facial sculpture, aesthetics, and you use HYAFILIA in your practice. And I would just want to ask you your opinion on what you like most about the filler range and why you use it compared to all the traditional fillers you may have used before.
Yes, when I started using the HYAFILIA family fillers, my patients talk to me like the natural results with no downtime. It's like a more stable and more safe product, I think. And when we do like a 12 or 10 mLs, another products, another brand, and the HYAFILIA I'm using like 6 or 8.
So you're saying that
Less
you're
mLs.
using less and getting more of a result.
Yes, getting more
That's
results.
fantastic.
And the natural results and the patients like 5 days after the procedures is very okay, is very low, is very satisfaction. And when we return, I using like 3 years. And when the patients return like 1 year after the procedure, we do like 6 or 8, and the return like 3, 4 to just maintains the results. It's very easy to patients and for us. It's like more stable.
That's fun. That's really good to hear that you're getting more quality, more quantity, and using less filler and actually achieving natural results.
Yes.
So earlier on, we had a good discussion about. You said that you get great projection with the some of the volume fillers,
Yes.
and a really good field smoothness with the quality of the filler. So you're getting projection and smoothness and tissue integration, which is amazing. So I would like to ask you, are you using HYAFILIA Soft for the lips? Do you find that soft is enough for projection and softness and results for the lips?
Yes, for the lips, I'm starting in most cases and with just 1 ml about the soft. And the young patients, it's
They
like
still achieve the
18 at 16 years patients is the same results, but in young patients, maybe I'm start like 1 ml, and after that I change to 1 ml about the soft, and like 1 month more, I'm start with the 1 ml about the medium.
Yeah.
To change to more projection and more natural results. Because when I start with the small, the soft, very integration, is
Good
very
soft,
is very smooth results, and the patterns not stay. The satisfaction is very okay about the soft and about the result. And
So
after
you
that,
also
we
use
do the medium,
Yeah.
more projection when the patient need. And when the patient need.
Our trends are changing from very, very sculpted to, much more of a natural look.
And for me, I think the most important is the very stable and precision hyaluronic acid. When you do the lips, and for example, when I start with the needle and after that a microcannula, and with the needle you do this and stay this.
Yes.
It's not no control. It's controlled results. It's very, very good. And when you use the volume, we have a great projection with expansion too.
Yeah.
The G prime is very important for this, for the projection and the expansion. And when I do all the fillers in the face, is very important. Different time about this. When you do the same, when you use 6 and compare to 12, you have with these results about this. The projection and expansion is very good to volume.
Yeah,
I prefer it.
And another thing about our HYAFILIA range, I feel that it has a rejuvenation effect as well. You're seeing that our patients are feeling hydrated, so they're getting a shine to their skin as well after they have their filler treatment, which is an additional benefit compared to traditional fillers that we're having.
It's a natural collagen stimulator, we can say. HYAFILIA is very, HA is.
Yes, it stimulates collagen and elastic into the skin as we're using it as well. So it's having a multi-pronged effect. So we're not just working on the structure and the shape and sculpting the skin. It's rejuvenating the skin as well and stimulating collagen and elastin.
Yeah.
But Dr. Altair, I would like to ask you, is there anything more that you feel that we should know about HYAFILIA and how you use it in your clinical practice, in your surgery, and how you use it every day?
The volume.
Volume,
The
that's your
volume.
favorite.
Yeah, it's my favorite about the nose, about the all the face, and in case in the lips too, the volume too. But in the nose, for example, I use just 0.2 to the supratip. It's very okay. It's very long time the results.
So the longevity is really
Yes,
good.
longevity. It's very good.
And also in the hands, you can use efficiently for hand rejuvenation.
Is that for volume loss? Yeah.
It can be used. It's very compatible also with other types of semi-permanent fillers.
I think we can agree that HYAFILIA is our favourite. We know that it's performing much better, superior quality to our traditional brands, and it's accessible for us, and the branding is great, so our patients love it. But thank you so much for joining us today.
Can I make a final remark?
Yes, of course.
Because we are doctors, but we are not sellers, we are not tradesmen, we are scientists.
Yes.
If I had not trusted this product, I wouldn't use it. I wouldn't talk about this product here. So I trust, and my patients are happy, I'm happy. So this is about trust and also the quality of the product.
And credibility.
This is very important.
Yeah.
Credibility.
Yes, absolutely. It's about credibility.
Safe for us and safe for the patients.
Yes. So we've got our top doctors from around the world that are using HYAFILIA that will now not use anything else.
Sure.
And that is the credibility that it deserves.
Very
and
important.
We thank you for it. Thank you.
Thank you.
Thank you. Okay.